Neurological disorders are very wide-ranging. They range from very complex disorders of cognitive function right through to disorders that are seemingly more straightforward, like migraines. And it's a very wide range of different problems that one sees. They can be difficult diagnostic problems, and you can really make a big difference to people's lives by treating them. At the moment, we're at a really exciting time in neuroscience. There have been a lot of changes, a lot of new developments in the way that the brain disorders are treated. If you take the example of migraine, for example, there's a new generation of drugs which are fantastically effective. They're monoclonal antibodies given by injection, and they are something of a breakthrough that really make a big difference to people's lives. And at the other end of the spectrum, with some of the more advanced neurodegenerative disorders, more complex neurodegenerative disorders, there are new generations of treatment just coming through. So it's a very exciting time to be working in this field. When patients come to see me at Cleveland Clinic London, I will start off by going through in detail the history of their symptoms, how they started, the ways in which they affect them. And having taken a history, I'll then do a detailed neurological examination, and we can usually get an idea of roughly what the problem is at that point, or what sort of problem it is, and then we very often need to do a number of additional tests. These might include MRI scans or electrical tests of brain waves or nerve function, blood tests sometimes. And then with those tests and the clinical assessment, you can usually get to a diagnosis in a pretty accurate way and then start talking about the treatment options. I think patients with neurological problems often have quite complex symptoms that may be quite difficult to explain. They're not, like some other disorders like chest pain or abdominal pain. They're quite complex phenomena. They sometimes have gone on for a long time, and so the history can be quite a complex thing to take, and you really need somebody who's willing to sit down and listen to you and listen to the history unfold without hurrying people. And by taking a really detailed history and letting people tell their story, that is the best way to really understand what is the condition that's affecting them, how it's affecting their lives, and ultimately to put yourself in a better position as a doctor to help them.